Hi, Dr. Innocent is here. I am starting a topic on the issues of hypertension, high blood pressure. Very important topic you will not want to miss. What do you know about hypertension? People are beginning to be aware that hypertension is a silent killer. They are becoming aware that it is very important to keep your blood pressure under control once you have it. At the same time, you might have hypertension without knowing. It is a common dangerous condition that majority of people have these days, both young and old, and can have it for many years without knowing, which can lead to various health conditions, especially heart-related disease. The worst of it is that even without having any sign or symptoms, damage to your heart and blood vessels continues. Hypertension is one of the leading causes of cardiovascular disease, kidney disease, cardiac arrest, stroke, heart attack, slump and pie, heart failure, coronary artery disease, and many more. Keeping your blood pressure under control is very important to preserve your health and to reduce the risk of potential effects of its dangerous condition. Now, here is the big problem with hypertension that a lot of people know nothing about. Hypertension is a complex condition. It is beyond just taking drugs, being on diets, and doing exercise to keep it under control. Taking your drugs, watching what you eat, and exercise is very good and necessary, but it is beyond that. Have you ever wondered why people who did all that to keep their blood pressure under control still slump and pie? Or why blood pressure keep getting high or fluctuating while still on medications and strictly on diets based on your doctor's advice? Or why you suddenly develop other conditions or symptoms while still on medication, keeping your blood pressure under control? Your blood pressure is normal, yet you start having other conditions you are not having before when your blood pressure was high. Have you ever wondered why? If you have, listen carefully. Apart from the side effects from the synthetic drugs and some of the medications used in the treatment or management of hypertension, which many people are becoming aware of, apart from that, there is another type of blood pressure called arterial hypertension. Not just hypertension, but arterial hypertension. I'm not talking about hypertension, which is the term used for low blood pressure. No, I'm not talking about that. I am talking about arterial hypertension. You might have not heard about it before. You only knows about hypertension or hypertension. The main problem with arterial hypertension is that you can never find out if you have it using BP monitor. It is not the same thing as hypertension or hypotension. You can find out with BP monitor. No, they are not the same. Arterial hypertension have to do directly with small blood vessels like temporal artery, vertebral artery, radial artery, anterior tibial artery, etc., and smallest tiny blood vessels like capillaries. Arterial hypertension is a big problem that people don't know anything about, and it is not even talked about in the healthcare system regarding blood pressure or blood circulatory related diseases. It is one of the main reasons why some hypertension patients who kept their blood pressure under control still slump and pie. It might be the reason why your blood pressure refuses to be normal, no matter how many drugs you have taken. It might also be the reason why your blood pressure becomes normal, yet you develop other conditions. Yes, you can have hypertension and arterial hypertension without knowing. As a matter of fact, most people who have helped cure their hypertension usually have arterial hypertension without knowing. They only become aware of it after proper diagnosis. And the sad part of it is that the arterial hypertension is usually the cause of their hypertension. You might wonder, how do we know that? Well, we have these diagnostic machines that detect the root cause of hypertension. It helps us know exactly how your hypertension came about and how it started. You can have arterial hypertension for like 2 years, 4 years, or even 6 years and more before having hypertension. And this is where the big problem lies. During this period, you might have heart-related issues without knowing too before the hypertension. And that is why at Vine Health, we don't use BP monitor as a yardstick to treat hypertension. No. We run a comprehensive blood circulatory system scan to find out if you have arterial hypertension or heart-related disease to ascertain exactly the root cause of your hypertension to ensure appropriate cure. Arterial hypertension have cost many people their life unknowingly. Most lump and pie you see or hear happening all over the place are usually caused by arterial hypertension. Yes, you can say it is caused by cardiac arrest, heart attack, heart failure, or hypertension. Yes, of course, you are right. But like what I always say, they don't just happen. There must be a root cause. Heart issues don't just happen like that. There must be a root cause. Something must definitely cause it to happen. Let me make this clear for you in case you don't know. Heart is the most strongest and guided organ in the human body. I call it the sacred organ. Your heart can never suddenly pack up without any serious issue. And arterial hypertension is always the cause of that serious issue. I know you will be surprised to hear this, but that is the fact. I am a holistic physician. We look at issues from the holistic perspective to find out exactly what is the root cause of an issue to ensure appropriate cure. Hypertension can be cured. Hypertension and its dangerous effects can be prevented once the root cause of it is detected, especially if it is detected early. Yes. On the next episode, I'll explain why arterial hypertension is a big problem to people with hypertension, how it causes heart issues, slump and pie, and why it can never be detected using BP monitor. Hypertension is a dangerous condition. It is causing a lot of issues in the lives of its victims. Arterial hypertension is a big problem to people with hypertension. So, if you are a hypertension patient and you don't want to be a victim of slump and pie or have other health conditions caused by hypertension, please listen to me. Don't use BP monitor as a yardstick for the treatment of your hypertension. You can use it to monitor your blood pressure, fine and very good at that. But don't use it as a yardstick for the treatment. Even if your blood pressure becomes normal, I still advise you to go for accurate diagnosis to find out if you have arterial hypertension or heart-related disease to ascertain the root cause of your hypertension. Be informed and save your life. If you don't know where to go to for your accurate diagnosis, we are here for you. Contact us today and you'll be glad you did. Please share this information to save others. I am Dr. Innocent, a holistic physician, servant and facilitator of nature. Thank you for watching.